Hello everyone, welcome to Forensic Extract and please do subscribe to Forensic Extract and press the bell icon and keep on watching. And today we'll be discussing about child abuse. So this is one of the important topic, child abuse. So thank you so much. Stay tuned. So let's discuss a case. There was a child, male child, 3-year old. His mother accompanied him to hospital and we examined the child, and the child was having multiple abrasions, multiple bruises, and laceration of lip. And the history given by mother was inconsistent with the all injuries, because the injuries were having different colors and different ages, and the mother was changing history frequently. So the history was inconsistent, and sometimes she was saying that these injuries were sustained due to fall from bed or fall from a stair. So she was changing the history frequently, and uh, on radiological examination, we found multiple rib fractures, and a string of bead appearance uh, on X-rays. So this was the finding on X-rays. So on the basis of this history, decide your diagnosis and make differentials on these findings, and let's discuss in detail, and then in the last of the video just examine yourself that whether your diagnosis was correct or not.
So guys, broadly child abuse is defined under an umbrella term that is known as child maltreatment. So child maltreatment is basically an umbrella term that is further divided into two categories. If there is act of commission, the parents or the caregivers are actively involved in child maltreatment, then this is known as child abuse. But if there is act of omission, it means if the parents or the caregivers are not acting or there is failure to act, then this is known as failure to act, then this is known as child neglect. Now this child neglect can be in the form of not providing nutrition, not providing education, or not providing the treatment to the child. Child neglect can be in various forms. Now the term child abuse is further divided or can be in various forms. So child abuse can be physical child abuse, it can be sexual child abuse, it can be psychological or emotional child abuse. Now this physical child abuse is further divided into various categories. So physical child abuse can be due to mechanical trauma, it can be due to mechanical trauma. So the two important example of this physical abuse are the battered baby syndrome and the shaken baby syndrome. These are two broad examples of this mechanical trauma or the physical child abuse. Now other examples of physical child abuse, it can be in the form of asphyxiation, like can be the parents or caregivers attempted to smother the child, smothering, or in the form of strangulation. So it can be in various forms like asphyxiation. Now the third type of the physical child abuse can be in the form of injuries like burn, scalds, or can be in the form of electric injuries also. So these are three broad categories of physical child abuse. One is it can be due to the physical trauma, the physical, that is due to mechanical trauma, like two broad category. One is battered baby syndrome, then shaken baby syndrome. Can be asphyxiation like smothering, strangulation and all. Can be in the form of burn, scalds and electrical injuries. Now, very important question that is frequently asked in various entrance as well as the PG university examination and UG examination also. Now, the syndrome is known as battered baby syndrome. So this battered baby syndrome is basically known as Caffey syndrome or Caffey's Kempe syndrome or non-accidental injuries of childhood. So non-accidental injury of childhood is also known as battered baby syndrome. Now this syndrome was first described in 1860 by Tardieu. So it is also known as Tardieu syndrome because it was first described by Tardieu. Now the battered baby syndrome is basically explained by Caffey's in 1946 and Kempis in 1962. They have explained the battered baby syndrome. Now the various features. So first is the features of battered baby syndrome. So battered baby syndrome is basically seen in male child, so slight propensity towards the male sex. It is seen in male child and age typically less than 5 years, or to be very precise, less than 3 years. Now the most characteristic feature is that the child is beaten repeatedly on most trivial provocation. So provocation is not that much of that much intensity. It is basically trivial provocation and child is beaten repeatedly.
Now various epidemiological factor. So epidemiology of battered baby syndrome is like the battered baby syndrome is mostly seen in the low socioeconomic strata, and it is basically seen in isolated families, and the parents are younger parents between the age of 20 to 30 years in most of the cases. Now this battered baby syndrome is mostly the parents are having criminal records, or basically the family is socially unstable. So it is seen in socially unstable family. Maybe family is having the psychiatric or the financial issues. So the parents may be having some psychiatric problems, or maybe some the emotional or financial problems. Now the parents in some cases were themselves is the battered child. So there is unhappy childhood experience. So parents are having unhappy childhood experience, and the family is basically violent and chaotic. So violent family. Now in some of the cases the parents are usually unemployed, and the atmosphere of family is disharmonious. So these are some of the epidemiological factors which are seen in battered baby syndrome. Now the most important finding to rule out battered baby syndrome is based on various features. Like first is the history. So history is basically given by the parents is that the repeated trauma over time. So this is the hallmark of better baby syndrome is repeated trauma over time. This is hallmark. This is hallmark of better baby syndrome. Now, can be injuries can be in the form of abrasion, in the form of bruise, burns, fractures, or any other injury of different ages. So the age of the injury, ages of injuries are different, and the classical explanation given by the parents is that the child fell down the stairs or from the bed. So if that were the cause, the fall were the cause, then the age of all injuries would be the same. But in this case, the age of all injuries is different. So this is the most characteristic feature on the hallmark of battered baby syndromes. And one more finding that parents change history as they go to different doctor. So frequent change of history. So this is also the feature of battered baby syndrome. And even they change the history with the same doctor, and their history may have serious contradictions. Now the various injuries. So injuries will note in external examination. So while external examining will note various external injuries. External injuries are most characteristic injuries are seen over the face, like the laceration of upper lip can be seen due to blow on the face or while suffocating the child. So most characteristic or the most typical injury, that is the tear of frenulum. It is the most typical injury that is seen in Bateman baby syndrome. Now, various other injuries like abrasions can be in the form of graze abrasions due to dragging of child. So, grazing and various bruises. Bruises can be in the form of the six-penny bruises due to rough handling of child. So the fingertips leaves the various bruises of six-penny size. So six-penny bruises can be knuckle punches, knuckle punches, in which around 4 to 5 round bruises are seen due to punch. Now can be multiple lacerations due to beating by hard blunt object. Can be pinch marks, pinch marks. Now, this pinch marks basically appears as butterfly shape. So these are basically butterfly shape, and the one wing caused by thumb that is larger as compared to other wing that is caused by opposing finger. So these are butterfly shape pinch marks can be seen. Maybe slap marks may be seen. This shows the clear bruises, and lines of particle hemorrhages may be seen, and the bruises are like resembling fingers. Now, the various scalp injuries are very characteristic, like hematoma, subgaleal hematoma. This is the collection of blood below the uh, galeal region. Now, can be due to the rough handling, beating, or kicking or throwing the child. There may be multiple bald patches on a scalp. So alopecia, traumatic alopecia can be seen. Now, the typical feature is, as we have discussed earlier, the typical feature of injuries are that they are of different ages, as they are inflicted at different point of time. So the age of the injuries uh, are different. So ages is different, and can be further, the injuries can be over various reasons. So injuries overall can be anywhere. The site is not specific. Can be in the form of laceration, in the form of bruise, can be in the form of abrasion, and all. So these are few external injuries. Now we'll proceed to the internal injuries. So internal injuries can be divided into various types. So first is skeletal injuries. So skeletal injuries can be seen in the form of skull fracture, and in most of the cases, these fractures are depressed fractures, and multiple and wide. There may be transverse fractures, transverse or spiral fracture due to twisting of large bone. So multiple transverse fractures and spiral fractures of long bone are also seen. There may be the traction lesions like lifting of periosteum and periosteal hematomas. So periosteal hematomas can be seen, and this finding can be seen radiologically as extra bulging of opacity along the affected length of the bone. So on radiological examination, this the affected length of the bone shows extra bulging due to the collection of blood under the periosteum. So this is the finding that can be noticed. Now there may be epiphyseal separation, metaphyseal avulsion, and all. These injuries in the long bones can be seen. Now, something that is due to compression of chest anteroposteriorly, there is fracture. So, if chest is compressed anteroposteriorly, there is compression of chest anteroposteriorly. So, multiple rib fractures are seen in the mid-axillary line. Mid-axillary line. But if the chest is compressed side to side, if it is compressed side to side, then there is multiple fractures at the anteriorly at the costochondral junction and posteriorly at the posterior angle of ribs. Now, what happens once these fractures has have occurred? After 1 to 2 weeks, there is formation of callus. So this callus basically appears on X-ray as string of beads. So on the ribs, like these are ribs, these multiple callus appear as a string of beads. So these appearances in paravertebral gutter, in the paravertebral gutter, these appearances are characteristic, and these fractures are known as knobbing fractures. Knobbing fractures. So multiple rib fractures are also seen. Now, second internal injuries can be injuries to various visceral organs. So visceral injuries can be in the form of brain injuries, and in brain there is hemorrhagic injuries like subdural hemorrhage. It is basically found in 40% cases. Approximately 40% cases are associated with SDH, and there may be bursting injuries to solid organs like liver, spleen, and all. Now, hollow viscera like the stomach, intestine, or urinary bladder may be ruptured, especially due to compression force. So, hollow viscera may be ruptured due to compression force. Now, the second part of duodenum or the jejunum may be completely transected because this part is fixed as compared to other intestine. So, there may be complete transection injuries may be seen. So complete transaction. Now there may be mesenteric tear. So tear of mesentery may be seen in some cases. Now how to diagnose battered baby syndrome? So far we have discussed about something about the clinical features. Now the epidemiological feature, the history, then the various examination, external as well as internal examination. Now how to basically diagnose the battered baby syndrome? So diagnosis In living, how to diagnose in living? So basically, there is time taken to seek advice is more. The parents are late in taking medical advice or seeking medical advice. Now, the nature of injury is quite different. So, first is the late medical advice, and the history is inconsistent. So, history is inconsistent with the injuries, nature of injuries, different types of injuries, multiple injuries, and different stages of healing. Now, recurrence of injuries is also a feature, recurrence. Now, various imaging studies like radiological assessment, like X-rays, MRIs, PET scan can be helpful in diagnosis uh, by doing assessment of various fractures or periosteal or epiphyseal or metaphyseal injuries. Now, how to diagnose in that? So basically, like in the living, various imaging studies before autopsy and various old fractures. So radiological findings or various injuries. Injuries are in different stages, same different stages. Now the cause of death in most of the cases is head injury. So most common cause is the head injury, and second most common cause is rupture of abdominal organ. So rupture of abdominal viscera is the second most common cause. So these are the cause of death in Battered baby syndrome. Now we have to differentiate this Battered baby syndrome from various other type of the differential diagnosis, like child may be having acute abdomen. So DD of this Battered baby syndrome, child may be having acute abdomen. So we have to rule out acute abdomen. Maybe the intrinsic intestinal disease, inflammatory bowel disease, some congenital anomalies may be there. Now, these multiple bruises can be ruled out with the deficiency of various clotting factors like and other coagulation disorders and bleeding disorders. So we have to rule out all these disorders. Now, various fractures can be ruled out and can be assessed. The like nutritional deficiency can be seen in rickets, can be seen in osteogenesis imperfecta, and others conditions. Now, the local erythema and bullae, so local redness or erythema, can be differentiated with various kind of infections like cellulitis, other bacterial infections, due to scraping or in case of smallpox or all, can be seen in simply in dermatitis or allergic or irritation. Now, the metaphyseal epiphyseal injuries, so bone injuries can be seen in similarly in nutritional deficiencies like scurvy or other vitamin or mineral deficiencies, syphilis and all. So these are basically few DDs which one should keep in mind while differentiating or while diagnosing Battered baby syndrome. So far we have covered the mechanical type of child abuse, and the first one is the Battered baby syndrome. Now we'll proceed to shaken baby syndrome. So second type of this mechanical trauma type of child abuse is the shaken baby syndrome. Shaken baby syndrome is also known as abusive head trauma, abusive head trauma, or infantile whiplash syndrome. Infantile whiplash syndrome. It is basically the uh, constellation of signs and symptoms due to violent shaking of head of an infant or a small child. So there is a feature that is very characteristic. And these are the signs and symptoms developed as a result of violent shaking of child. So the salient features related to the shaken baby syndrome. So various features. Now the features are basically due to the violent shaking, and this violent shaking due to the persistent or inconsolable crying, the caretaker shakes the child violently in the out of frustration or rage. So this is the etiology basically. So the sign and symptoms are due to violent shaking. Now the mostly the brain injuries that suffered the damage and degree of brain injury depends on the amount or duration of shaking. So the most characteristic is the shaking of child out of rage or frustration, and brain injuries are characteristically seen due to violent shaking because the head of child is quite large as compared to rest of the body. So the head or the rest of the body ratio is quite more, so that's why there is chances of the injuries are more because of violent shaking. There is to and fro and side to side movement of brain in the skull. So there are various kind of intracranial hemorrhages. Now the various signs and symptoms. So signs and symptoms of shaken baby syndrome. Basically, it is known as pediatric abusive head trauma, as we have discussed. So cause of death in approximately 30% cases, the infants are dead because the abusive head trauma is that much serious that it causes death in about 30% cases and permanent neurological damage in about 80% victims. So death occurs in 30% cases and permanent neurological damage that is seen in 80% cases. And there may be neurological deficit in the form of irritability, intellectual visual deficit. There may be seizures, coma, stupor, or death. So neurological deficits may be seen. Now, the permanent brain injury is caused by the habitual prolonged shaking. So maybe permanent brain injury can be seen. One of the triad that is characteristic of this shaken baby syndrome that is seen. So what is that triad? So this triad consists of the subdural hemorrhage. Because of violent shaking, the acceleration and deceleration force and the large head and weak cervical musculature of an infant or a small child, what happens? There is a collection of blood underneath the durameter. So this is known as SDH. Due to tearing force and shearing force, there is collection of blood. So SDH is characteristically seen, and there may be brain swelling, brain edema, or brain swelling, or encephalopathy. Encephalopathy can be seen. Now the third feature is the retinal hemorrhage. Due to traction force or violent shaking, retinal hemorrhages are seen. So these three important features, SDH, brain swelling or encephalopathy, and multiple retinal hemorrhages, are classically seen in the triad of shaken baby syndrome. The difference between battered baby syndrome and the shaken baby syndrome. This is very important. In case of battered baby syndrome, the intention of adult is quite different because in case of battered baby syndrome, the intention is always to harm the child. So intention is to harm the child, but it is not seen in shaken baby syndrome. The intention is not to harm the child. It is basically the anger or the out of frustration or out of rage, the attendant or caregivers shakes the child violently. Now the injuries are in the form of abrasion, contusions, lacerations, and all, as we have discussed. So these are the injuries in various stages of healing. So these multiple injuries are the features of Better baby syndrome, but such injuries are not seen. There may be multiple fractures, there may be multiple injuries to visceral or hollow viscous, but these characteristic injuries, like in multiple stages of healings, are not seen in case of this shaken baby syndrome. Now, what happens in case of shaken baby syndrome? It is basically due to violent shaking. Violent shaking. So, a characteristic triad is seen that we have just discussed. This kind of injuries like retinal hemorrhages or the encephalopathy or permanent or neurological deficit are not seen or not characteristic of this battered baby syndrome.